the way in which we die matters, and that people can have good deaths, and that we should strive for that. But that's a construct that if someone asks you about, you can, but to try to, I have a great deal of hesitation to try to tell people that that's something we can achieve. I think it's a reasonable goal to put out there. But they may, I mean, there are people, you know, who are, they have no interest in dying. and they just don't. And so it's a matter of trying to figure out where they are in those situations. On the other hand, if someone says, okay, what can you do for me? Then I think we're all for saying, well, there's lots. There's so much growth. There's so much closure that can happen.
I deal with it every day. I'm the hospice medical director, and people sometimes say to me, how do you do that? I mean, how do you do that? And I oftentimes will say to them, well, it's oftentimes more about the family than the patient, because that's what kind of keeps me going. Sometimes the patients are pretty far along. But it's fascinating to watch families go through this, because a lot of issues that they've dealt with all these years kind of come to the surface. They boil to the surface. And that's why on our hospice team we have social workers and chaplains, and it's really a team effort. And since you brought that up, I want to talk about a difficult time. There's a concept in the palliative care literature called total pain. And sometimes we, no matter what we do, and you know, pain is what the patient says it is, but we don't understand why that patient's having so much pain, and we dig a little deeper. And people that are very young, you know, we have people with difficult cancers in their 20s and 30s, with little children. Those people are not ready to die, and they don't want to die. Or people who have been perpetrators or abusive, and they haven't made their peace. Sometimes those patients have a very hard time. And it's no matter how much pain medicine we give them or whatever we do, that's when you call in the troops, the chaplain and the social worker, and get those things out on the table. Then things go so much better, okay? And it's an important part of what we do at the end of life. And you can give people peace sometimes that don't have it.